Hello, podcast listeners. You are now listening to the Coffee, Health, and Science Podcast. I am your host, Jordan River, and I want to thank you for tuning in today. Before we get started, share the Coffee, Health, and Science Podcast with a coffee drinker, with a peer, with a colleague. We appreciate you spreading the show. Make sure you're subscribed. Give us a good rating and review. It really helps us grow as a show. You have no idea how much we appreciate that. Today, a very special episode indeed. I'm sitting here with my Pocket Purity steepable coffee, going to take a little sip. And I'm excited to dive into today's interview because it's a hot topic in the world of natural health. I mean, it is becoming absolutely ubiquitous in the world of supplements and wellness. Today, we are talking about CBD, and we've got a great expert on the phone. We have Dr. Jean Tallyrand. I hope I did okay with your name. How are you doing, Dr. Tallyrand?
Doing well. It's a nice day here in San Francisco. So
nice. Can't complain then, right? Thank you so much for taking time to come on the show. I really appreciate it.
Oh, my pleasure.
So listen, where do we begin? The Coffee, Health, and Science Podcast, we really like to explore all sorts of health science angles, especially natural health science angles. And CBD, man, oh my God, it's taken the world by storm. It's taken this nation by storm. It's becoming absolutely ubiquitous. First, talk to me about yourself, your medical background, and then when CBD kind of entered your scope.
Sure. Well, let's see. I started in medicine from the womb, I should say. I grew up in a medical household.
Oh,
wow. My father's a pathologist. My mother's a pharmacist. And so my grandfather's a physician as well. So imagine dinner time. We often discussed many things, including the trials and tribulations of the medical industry.
Wow.
I actually didn't think I would go into medicine after all those dinner time conversations.
Right.
But I eventually did.
But here you are.
Right. Let's see. I went to medical school at Boston University. And for those who don't know, Boston is the mecca of traditional conservative medicine.
Mm-hmm.
And then I did my family medicine residency training in San Francisco, which is where I live right now.
Nice.
San Francisco is also a well-known medical environment, but the cultures are opposite. So It was interesting to go from one side of the coast and one type of medical culture to the other.
To the polar opposite.
Exactly.
That's really
and I definitely looked at medicine with a critical eye, having grown up hearing my family members talk about it.
Right.
So when I came to San Francisco, it was refreshing in a way. It felt like I'd arrived because San Francisco embraced complementary and alternative approaches. And also there was a cannabis culture in California.
Long established, right?
Right. Well, during my residency, the Compassionate Use Act was passed in California, which allowed access to cannabis for medical purposes. So I learned as I was training, I learned about cannabis as well, and in my training I focus on complementary and alternative medicine. So that's how I came to know about CBD.
That's so wild. So I mean, all the way back in the 90s. There were people using medical marijuana in California, and it was much more touchy back then because this is the flower that you smoke with the THC and everything. What really seemed to cause the separation and break off this treatment into natural society is when these producers started isolating certain compounds, specifically CBD, which does not get you high. And that is the compound which is so anti-inflammatory, so beneficial. Am I on the right track there? How can you talk to the audience who may not be familiar with CBD and talk about the difference between medical marijuana and cannabidiol, the molecule?
Well, they both come from the cannabis plant.
Right.
But you're right. Well, science has isolated the active constituents, the major constituents of the cannabis plant since the 1960s.
Oh, wow.
Yeah, so we knew about CBD quite early on, and many studies were done on it, but there was this prohibition, right? And so human trials didn't happen. It
Whoa.
was mostly bench research, right, to petri dishes and things like that. So there was a lack of information on it. So, but CBD is different than THC, which is the well-known active ingredient of cannabis. And actually, there are two types of plants. There's a high THC plant, and then there's a high CBD plant. And during Prohibition, cannabis was used mostly, illicitly for the high, sold in the black market.
Focused on that THC is what you're saying.
Exactly. And the CBD plants nearly disappeared. Nobody was growing them. So it wasn't until the prohibition was repealed and medical cannabis was allowed that CBD was able to be cultivated and come back.
And it's truly exploded as far as a supplement. I see people who would never use weed using CBD every single day. I mean, it's like it really truly seems to be a powerful anti-inflammatory supplement, among other things. How do you feel about the common consensus of marijuana versus CBD with your patients, but then also with doctors? Like, our doctors, I'd imagine that doctors, they understand isolated compounds, they understand this stuff. Is there still a pushback, or are doctors for the most part down with CBD?
They don't know about it. We weren't taught in medical school. Yeah. So a lot of people are using it, and doctors are shrugging their shoulders.
Whoa.
Those who know about cannabis know that for the most part, it doesn't have any serious adverse events or negative effects. But
right, not like the other psychoactives like your alcohols and things like that. And I know there's more research that needs to be done, but yeah, there seems to be way less going on there.
Right. But THC, CBD, it's not taught. The endocannabinoid system, I don't know. It's a system that we recently discovered in the early 1990s that related to THC and CBD, and how we have, in all of us, in all animals, similar chemicals that affect receptors. So we discovered these receptors. We didn't know what they were doing before, but now we're just seeing that it's involved in, as you say, inflammation, and involved in appetite and sleep patterns.
Yeah, and sexual patterns and sexual health, things like that. I'm understanding. I've always been fascinated by the endocannabinoid system. I don't really understand it. Is that because no one quite understands it, or how does that work?
we're so in science, let's see, so from 1990, 88, 90 to now is a short 30 years in science. That's not a long time to fully understand everything. So, but we have definitely many studies on the endocannabinoid system, and we're learning more and more. And also, there have already been many pharmaceutical companies that have created, drugs targeting the endocannabinoid system.
So fascinating.
So it's really amazing.
Yeah, it's a super fascinating field to me. It's like brand new territory being broken. This is like the final frontier.
Right. And another frontier, an interesting frontier, and hopefully, a lot of good treatment coming from it.
That's what I'm excited to see, really, is the two clashing of the worlds. What do we know about why CBD is good for you? Like, I know there's a lot of speculation out there, but can you, as a medical professional, say we know this about CBD and its benefits?
Well, one thing we know is it's fairly harmless. There are some adverse events or negative effects, but but not many compared to many. So that's the good news, and that's because many people are taking it. But that there have been some clinical studies showing CBD is helpful in certain anxieties, social anxiety,
Oh, for sure.
particularly.
I think
Yeah.
anybody who's tried it wouldn't argue with that.
Inflammation, not so much clinical human trials, but more animal studies
Oh,
showing its anti-inflammatory effect. And of course, the biggest one, the one pharmaceutical grade product that was released. Let's see, was that last year or 2 years ago?
oh, for the epilepsy.
Yeah, for epilepsy.
Yes.
For Epidiolex is the name of it. GW Pharmaceuticals. So that's a CBD.
Treatment.
Plant-derived CBD treatment. Yeah.
That's so interesting. You know, I got off my Lamictal and I only take CBD now.
Oh, wow.
I've been seizure free. Yeah, it's really quite incredible. And my understanding is that they haven't quite dialed in those CBD drugs yet. But I would love to see that further, right? Like, why not? That's really, really interesting. And I don't want to say an ex-epileptic, as an epileptic, CBD, it's such an important option that you consider if you're having any sort of symptoms. Is that the one that really no one's arguing with, Dr. Tallyrand? Like, there's real research that shows that this stops seizures, right?
There's real research, but there's always arguments.
Right. Good point.
I don't know. One of the issues with CBD is dosage. CBD is
wildly hard to dose.
Yeah, but most of the studies performed were with CBD at higher doses, anywhere from 300 milligram to up to 1,500 milligram doses.
Wow.
But if you go out and you purchase the CBD, you'll see that the dosage is presented at 5 milligrams, maybe 50 at the most.
Right.
And so there's a big discrepancy between what's available and what's indicated, specifically for seizures.
That's a huge distinction.
Yeah, yeah. So that's you've got to be careful, understand the dosage, and
But that's weird. Is it because it's so benign that you can just take these massive quantities of it?
Yeah, that and the regulatory world, CBD is coming from a plant. It's really THC that's been prohibitive to the DEA and NIDA, and so CBD is becoming more and more available.
Yeah.
Now the FDA is saying you can't sell CBD and claim medical effects without doing appropriate studies.
That's crazy. I just feel bad because I don't want people to miss out on wellness because of red tape. But again, that's their job. They're trying to make sure people don't take things that are bad for them. It's tough.
Right.
It's really tough.
Right. Safety is important and correct dosage is important. They just pointed out, there's discrepancy in dosage.
But access to medicine is important too. That's a tough one.
That's true. The other thing about CBD that's interesting is that we're seeing that CBD doesn't act alone. It's got, the plant has many active ingredients, and generally, if you use more than one ingredient, you're going to get a better effect than if you just use CBD.
Same thing with coffee. That's synergizing. There's some sort of synergy that takes place. The entourage effect, I've heard it called. Same thing with coffee. Yeah. We know that caffeine doesn't prevent dementia, but we know that decaffeinated coffee doesn't have the huge reductions that caffeinated coffee does. Something about the whole is greater than the sum of the parts. You know what I mean?
Right. I understand. Yeah. No, it is. But in the pharmaceutical development process, every time you add an active ingredient to your final formulation, you bring on exponential complexity. Are they interacting? Are they diminishing each other? What's causing which effect? And that's why you see many drugs out there don't have more than one active ingredient in them. It's a difficult process.
But that's exactly why it's so crazy with coffee. We can't study it. We can't do a double-blind control study where you have someone go around and be served a fake placebo coffee every day next to the control who's getting the real coffee every day, and they have no idea the difference. And you've tested the coffees to see which hundreds of compounds are in which. So I don't even know if it's like a valid pursuit. Very, very interesting, man.
Well, the positive picture of it all is that coffee's been used for years and years, and we can get some observational studies. That's really so. Yeah. About 5 years ago, a partner and I started a cannabis research institute, and our approach, rather than the traditional take one ingredient and study it, is to really observe the massive amount of people using the product. Just maybe give us a hint as to what is effective, what's not effective, what's causing harm.
Just like the coffee thing. Exactly right.
Exactly. It's sort of approaching it backwards almost, but really getting to the answer sooner. Whoa. and maybe causing, better, giving us more idea of what works and what doesn't. Otherwise, it's like hunting for a needle in a haystack. Just figure out what's the perfect formulation for the person.
That makes sense. And I feel rather neuroprotected from my daily CBD supplement to my 3 to 5 cups of coffee. I am pretty sure that I don't think there's any two substances on the planet that have such wide range of health effects. It's very strange how the list of ailments that cannabis prevents and cures and the disease prevention of coffee are so wide arrayed. It's very, very fascinating to me.
It is fascinating. And to point out also that they both come from a plant, as a lot of medicine has.
Oh, give me a break. That's where it all came from before. Yeah. I mean, what do you think the aspirin's derived from, right? So
right, exactly.
Yeah. So I would like to hear, though, more speculative research. Is there anything that you can share with us that maybe CBD does? Maybe some people are studying to see if there's a little bit of play in different categories that we might not know of yet?
So you pointed out the anti-inflammatory, the anti-seizure, the anti-anxiety.
What about, talk to me about cancer? I know that's a much touchier one.
Yes, there's definitely evidence of anti-cancer effects. So there a lot of potential. The biggest question for our group is what is it really CBD or is it CBDA? So CBDA is actually the more natural, quote unquote, chemical. See, that's the way the plant produces CBD. Oh, okay. And usually in processing, the A comes off. Okay. The A stands for carboxylic acid. So it comes off and we're left with CBD. Now, that was important for a lot of folks with THC. The THCA is produced and the A comes off. And when the A comes off, you get the psychoactive high. Okay. So it was important and the A can come off, when you heat up the plant. So you roll the joint, you light it, and you decarboxylate, you take off the acid.
The process is taken care of for you.
Right. Okay. Right. So a lot of manufacturing naturally just automatically started taking the acid off. But what we're finding is CBDA may be more bioavailable. It may be the better active ingredient. And so that's really where we're going. As well, it's likely that CBD, because it doesn't act best alone, will be added to other. You mentioned coffee, CBD and coffee. Yep. Maybe people definitely those products are out there. They may be a great combination. But even with pharmaceuticals, CBD and ibuprofen or Tylenol. Yeah, CBD and the benzodiazepine. So it may change the world of
that's the fucking crazy. World. That's so interesting.
Yeah.
Wow.
Very interesting.
What about negative effects? I mean, you say that as a doctor, you're saying that there's very little negative effects. I remember seeing a research paper not too long ago talking about liver damage. I thought that was interesting. It seemed a little, I was a little suspect of it, but maybe you can talk to me about any real substance on possible negative effects of just CBD.
Right. We have the World Health Organization produced a white paper on CBD and listed some of the negative effects seen, and because it's relatively new, we're likely to find more. But it's relatively benign.
Yeah.
Let's see. Some folks report dizziness. Some folks report headaches. Usually, these are at very high doses.
Interesting. And I would also be interested to know how those plants were grown. Having done so much work in the agriculture field or regenerative organic field, I can tell you that it probably heavily depends on how that plant was grown, I'd imagine. Well, that's just me personally. I'm a cultivator. You're a doctor. Maybe we come from different areas, but I would say I would love to see a split test done between regenerative organic CBD and maybe some not so regenerative organic CBD.
Well, most of the solid data is with CBD alone. So these have been reported with CBD alone. And you raised a great point. It's never alone. It's always with other things. And so the high doses are required when it's alone.
Oh, I see.
And so maybe when it's mixed with others, there are other things. It's less likely to.
Okay. I'm following you. You need a lesser dose. Yeah, you're not going to need the high dose. Maybe you'll have less side effects even.
Right.
Interesting. Right. So sorry, I kind of cut you off there. Was that there's that one paper you said the World Health Organization put it out? Is that pretty much it?
Oh no. Well, I mean that's sort of the definitive list of negative effects, but yeah, not very many. Dizziness, headaches. Some folks got diarrhea. It sort of sounds like the list that you see when a pharmaceutical is advertised on television. But we're not seeing any deaths. We're not seeing any serious adverse events with it. So it's like I said, relatively benign.
So, if you're comparing it to other pharmaceuticals and it's, benign compared to them, what's the problem? I think that some people are a little bit hesitant because it is natural and it does come from a plant, and maybe that makes it a little unpredictable in their eyes.
Well, with problems with physicians is we have a hard time acting with the unknown.
Right.
It could be the best medicine out there, but if we haven't properly studied it, you're not going to see many physicians take their necks out. That's really what's missing is we really got to put it through all the trials and really get some answers. And that's what we're trying to do.
Well, that's what we, love you doing out there, Dr. Tallyrand. Someone's got to do this work. It's a tough CBD job, but someone's got to do it, and we appreciate you. Where can my listeners find out more about you and everything you're doing? I know you're working with a great company, Rooted Life CBD, ROOTEDLYFE.com. You listeners, if you're just getting started in CBD, I wanted to throw that out there because Dr. Tallyrand works with Rooted Life. I know Rooted Life, and they're great people. But yeah, anywhere else my listeners can find you?
Right. Yes. Rooted Life. I advise them, and I'm on their advisory board. Our research organization is called the CESC. So you can look us up at www.thecesc.org. And if you are interested in participating in any of our studies, we're happy to have you join.
That's awesome. Well, there's a lot of medical professionals listening to this cast, so hopefully we get some movement there. You heard it here, everybody. Follow Dr. Tallyrand, everything he's doing. Thank you so much for taking the time to do this today, my friend. We should speak again shortly.
Happy to do it. Thanks for having me.
Awesome. Everybody out there, thank you for tuning in. We're going to run today. Stay tuned for more awesome content coming at you with your hot cup of coffee. This is Jordan River and Dr. Tallyrand signing off saying have an extraordinary day. We'll see you next time on the Coffee, Health, and Science Podcast. Bye-bye.